Good day, dear students. This is Dr. Mitra. I am Associate Professor from the Department of Conservative Dentistry and Endodontics, Sri Balaji Dental College and Hospitals. Welcome to my next session for Raaonline Dental. And today we are going to cover a very important topic from the exam point of view, which is going to be anatomy of the pulp. We are going to see various root canal configurations, and we are also going to see one important essay question, which is access cavity preparation. Okay, let's go on to the class now. The contents of today's class is going to be introduction. We are going to see the anatomy of the pulp and root canal system, the various root canal configurations like Vertice, Gulabi Wala, Cattrall, Johnson, etc. We are also going to see the root canal configurations of individual teeth and the incidence of additional canals. Then we are going to go into detail about access cavity preparation. We are going to see what is the definition of access cavity, what are the various objectives of access cavity preparation, what are the guidelines and the principles of access cavity preparation, what are the various instruments that are used for the access cavity preparation, the clinical steps in access cavity preparation for anterior teeth as well as for posterior teeth. We are also going to see the errors and the anomalies, what all mistakes you can make in access cavity preparation. Then we are going to see certain recent advances in access cavity preparation, and finally the conclusion. It's going to be a very interesting topic for you today. So first is the introduction. So the successful endodontic therapy depends upon the thorough knowledge of the root canal anatomy and the morphology of the tooth, which is very, very important. So the entire dental pulp is referred to as the root canal system. So the pulp is basically a soft tissue and it is of mesenchymal origin, and it is developed from certain specialized cells, and the odontoblasts are arranged peripherally in direct contact with the dentin matrix. So the odontoblasts, they are responsible for the development of the dentin, and the pulp is developed from the cells of the mesenchymal origin. Many changes occur in pulp cavity depending upon the age and when it's affected by disease and when a trauma occurs to the particular tooth. So going into detail about the anatomy of pulp and the root canal system. So first you see the pulp is basically a central cavity that is occurring within the tooth, and it is enclosed completely by dentin. Okay, so what we see on the crown part is called the coronal dentin, and what we see in the root portion is called as a radicular dentin. So basically the tooth, you can divide it into two parts. You can divide it into crown and you can divide it into root. So that part which is joining the crown and the root is called as the neck of the tooth. Okay, so the neck of the tooth corresponds to the cemento-enamel junction. Remember, the neck of the tooth corresponds to the cemento-enamel junction. So as you can see here, so the outermost layer of the tooth is the enamel. This is the second layer of the tooth is the dentin, and innermost you have the pulp. So there is your gingiva and the alveolar bone and the periodontal ligament. So the tooth is held in position in the socket by means of the periodontal ligament, which are delicate fibers that anchor the tooth, that hold the tooth. They basically hold the tooth in the alveolar socket. Okay, so the covering of the root is called as a cementum. So as I told you, the crown, there is a root. So the root is covered by the cementum. The covering on the root is called as a cementum. So that part of the pulp which is inside the crown of the tooth is called as a pulp chamber, and that part of the pulp that extends into the canal, that extends into the radicular dentin, that extends deep inside the bone, is called as a root canal. Okay, so the pulp chamber, this is the pulp chamber and this is the root canal. So in the coronal pulp, this is the coronal pulp. What you see here is the coronal pulp, which is also called as a pulp chamber, and this is the radicular pulp that extends into the root canal. So this is the basic configuration of the tooth.